Hello and welcome. I'm Dr. Usama Ibrahim from Easy and Different Radiology. Actually, I want to start today a course for basic knowledge on MRI level 1 for beginner. So let's do it. The learning objective from my presentation is how to differentiate CT versus MRI, how to differentiate T1 versus T2 MRI signal, and what is the MRI sequences and MRI planes. So this lesson is gonna be short and sweet, but we are going to get to the bottom of this. So let's start and do it. CT versus MRI. As the CT images or X-ray, the white areas is represented as high density. However, the white areas on an MRI images is equal high signal. This is the first difference and in meaning and in pronunciation. This is an example of CT brain without contrast. As we see, the calvarial bone appeared white here, and so the bone or high density, this is representing a high density. Compared with this MRI T1 weighted image sequence for the brain, the calvarial bones appeared black and subcutaneous fat appeared bright, as we see here. So the bright fat here is white area and representing a high signal in MRI. So bright area in CT is high density. However, bright area in MRI is representing high signal. T1 versus T2. Milliseconds after removal of each radiofrequency pulse, the excited protons relax, giving off radiofrequency signal, which is detected by the scanner. There are two types of relaxation occurs: realignment of the protons with the magnetic field and dephasing of spinning protons, loss of resonance. We'll explain that by diagrams in the next slides, and this is the main issue or physics for introducing T1 and T2 signal in the MRI images. This diagram showing the protons in the body, which in the normal situations without entering the MRI machine, it randomly distributed like this in the body. However, if these protons in the body are exposed to the magnetic field of the MRI machine, most of them are following the high field of the magnetic machine like this, and the other taking the other directions as north direction. Then we introduce radiofrequency pulse for the machine during the patient in the scanner, and this radiofrequency pulse resulting in realignment of these protons, which go to in the other directions to be follow the directions of the MRI machine. After that, all these are simulating. Still, we don't get signal from MRI. After that, there are two types of relaxation. The first one is realignment of these occurring due to realignment of these protons in the same directions of the magnetic field, and this realignment give the first signal. And the other signal is due to relaxations of this radio frequency, and they turn it off. When turn it off, the protons is returning to the same direction again, producing energy. This energy can be picked up by the computer and get it a signal from it, which appearing on the MRI as a high or low signal. And also there are another movement of the protons, which is called the processing movement around its axis, and this also making energy, and we can detect the energy when during relaxations and get up signal from this. This is the basic physics, how can get the signal from MRI. Now we have two types of signal detected. T1 signal relates to the speed of the realignment with the magnetic field, as we described before in the previous slides. The realignment of the protons according to the speed of this realignment with the magnetic field, the more quickly the protons realigned, the greater the signal in the T1, and this occurs with fat. If there are any fat in the body, it is realigned quickly after switched off of the radio frequency, and this realignment quickly with the protons of the magnetic field, leading to high signal in the T1 and representing fat. However, the T2 appeared due to signal related to the speed of the proton spin dephasing, and this depends on the slower of the dephasing, the greater the signal in the T2. This can occur with fat and water, which appearing in the T2 as high signal, because these structures are slower to be dephasing, as also we described in the previous diagram. Now we get two signals, signal T1 and signal T2, and this is the basic physics for the getting up of these signals from the MRI machine. So now the MRI sequences is T1 and T2. This is the main sequence. There are other sequences or specific sequences, and this will discuss it in the level 2. Today we should discriminate T1 from T2 according to the previous physical concepts. Okay, now we want to practice on the real image of MRI to detect the signals or discriminate the T1 signal from T2. As we described before, the T1 signals is dependent on the quick of the realignment of the protons. It get high signal in the T1, like this fat in the subcutaneous area, this lumbosacral spine, which appearing a high signal in the T1. However, the CSF in the spinal canal is low signal. So only one structures, fat, become high signal, not water, fat and water. Fat become high signal only. So this is the T1 sequence. Comparing with this T2 sequence, which showing high signal of both fat in the subcutaneous tissue and also water in the CSF space. So high signal of both fat and water, meaning this is T2 signal. By the other meaning, if there are two bright, fat and water, so this is T2. If only there are one bright, fat only, this is meaning T1. And this is the difference between the T1 and T2. Again, this is coronal images for the brain, and this signal showing the subcutaneous fat which appearing bright. However, the CSF is not bright, so this is only one bright, so meaning T1. Compared with the other image, which is showing water of CSF within the ventricles and within the CSF space, also in the spinal canal, is bright. Also fat in the subcutaneous tissue, in the scalp, appeared bright. The fat also in the neck appeared bright in the neck spaces. So fat is bright and water is bright, so there are two bright objects or structures in the study. This is meaning this is T2. So now we can discriminate T1 from T2. Now we want to talk about other issue related to MRI. This is called MRI planes, because the MRI can be examined in axial plane, in coronal plane, or sagittal plane. As you see here, this image is a sagittal MRI plane. Sagittal representing lateral view in the X-ray or radiograph, in the ordinary radiograph, like lateral view. So this is sagittal view, which is showing cerebellum and brainstem, spinal cord, and the brain tissue. So this is a sagittal planes. However, this is coronal plane representing frontal view, as represented by the plane radiograph. This is a frontal view or coronal plane in the MRI. And the axial image, like CT, axial image is the other plane. So we have three planes: axial, coronal, and sagittal. And now we can discriminate the three images from each other. I want to finish up today's lesson with a fixed expression that seems to challenge these rules a little. Challenge 1. This image, we want to discriminate which planes, sagittal, coronal, or axial, which sequence, T1 or T2, and what is the site or part of the body is examined. I will give you 10 seconds to challenge yourself, and then I will answer the case. This is sagittal image because it looks like lateral view, and there are only one bright is subcutaneous fat or epidural fat or fat in the bone marrow, all these fat structures. However, the water, the other element, is dark. Only one is bright, so it is T1. So sagittal T1, and the part examined is the lumbosacral spine. So sagittal T1 lumbosacral spine. We have 20 challenge, so I explain in the first one. The next you can examine yourself or challenge yourself. This is coronal image T1 because only fat is bright. However, the articular cartilage is dark, which contain fluids, and this is leg, both legs. So this is coronal T1 both legs. This is an axial image which is showing the tendon Achilles here and the other tendons of the ankle, and this is part from the fibula, and this is the talus, and this is the tendons here. So the subcutaneous fat is bright, and also the fluid surrounding this tendon is bright. So there are two elements are bright. So this is T2. So axial T2 and ankle is a part of examined. Axial T2 Brain. Axial image because it is looks like CT. T1 because the subcutaneous fat only is bright. However, the CSF in the spinal canal is dark, and this is lumbosacral spine. So axial T1 lumbosacral spine. This bright issue is the epidural fat, and this is the fat, mesenteric fat or paraspinal fat, and this subcutaneous fat. All one element is the fat is bright. However, the fluid appears dark, so this is T1. Coronal image of the brain, and the T2 because fat is bright and the fluid as CSF in the sulci appeared bright also. So this is coronal T2 brain. Sagittal image, as we see in the ankle region, and T1 because subcutaneous fat in here and in the plantar aspect, in the back of the calcaneus and also tendon Achilles, and in the Kager fat bed, retrotalar here, all these fat appeared bright. However, the fluids in the articular cartilage appear dark, so this is T1. T1 ankle sagittal view. This is sagittal image, as we see, looks like lateral. This is the bones, midbrains, and spinal cord cerebellum. Fluid CSF in the fourth ventricles and in the other sulci appeared bright. So this is T2 because also subcutaneous fat is bright. And the brain is not appeared completely. So this examination is for the pituitary gland. Pituitary gland actually has focal lesions. However, the study is the sagittal T2 for the pituitary gland. This is the coronal imaging for the wrist joint, and this is T2 because the fluids in the articular cartilage is appeared bright and also subcutaneous fats appeared bright. So this is coronal T2 for the wrist joint. Challenge 10. Examined part is the knee and the plane is sagittal plane and the fat appeared bright. However, the fluids in the articular cartilage appeared, hyaline cartilage here appeared dark. So this is only one object appeared bright, which is fat. However, the fluid is dark. So this is T1 knee sagittal image. Sagittal T1 knee. Challenge 11. Coronal image T1 because the fluid in the articular cartilage is dark and the subcutaneous fat is bright. So this is T1 knee coronal image. A little bit more challenge cases. Axial image for the lumbosacral spine, and the subcutaneous fats appeared bright and the other fats in the body appeared bright. However, the spinal canal, and this is the roots of the coda equina, appeared within the CSF, which is bright. So the CSF bright and epidural fat is bright, subcutaneous fat bright, the fat and water appeared bright. Two objects are bright, so this is T2 axial T2 lumbosacral spine. Challenge 13. Coronal T1 for the wrist joint is a part examined, and T1 because the fat only appeared bright. However, the articular cartilage is dark, so the fluid is dark, the water is dark. Only one object is bright, which is fat, and the part examined is wrist, and the image is coronal because it looks like anteroposterior view of the radiograph. So coronal T1 wrist. Challenge 14. Axial image for the wrist in the T1 because the fat only, subcutaneous fats appeared bright and the bone marrow fat appeared bright. However, the fluid in the carpal tunnel or the fluids appeared dark, so this is axial T1 wrist joint. Next challenge is the coronal image for the brain. As we see the brain in the frontal view, so this is coronal and this is brain. Part examined is brain. T2, why T2? Because CSF is bright and fat, subcutaneous fat or neck fat is bright. So fat and water are bright, so this is T2. Challenge 16. Coronal T1 for the ankle joint. This is the tibia, medial malleolus and fibula, and the articular cartilage which contain fluids is dark. However, the subcutaneous fat is bright. So only one object is bright, so it is T1. Coronal T1 of the ankle. Examined part here is the ankle. Challenge 17. Coronal image for the ankle joint. Comparing with the previous study, the articular cartilage here appeared bright due to fluids within it. So water is bright and the fat is bright. So two objects are bright, so it is T2. So coronal T2, examined part here is the ankle. Coronal T2 ankle joint. Challenge 18. Sagittal T2 lumbosacral spine. Challenge 19. Axial T1 brain. Examined part is the brain. Last challenge. Sagittal image. Examine the part lumbosacral spine. Bright fat, bright CSF. So it is T2. Sagittal T2 LSS. At the end, this is my reference, most of it from my daily work cases. I hope that I have given you some interesting ideas. It's gonna help you to become more fluent and more confident when facing MRI film. Thank you very much for your watching and have a nice day.